Well, good afternoon, everyone. And to kick off today's COVID-19 update briefing, I'll start with some good news. Illinois has set a new all-time testing record with over 95,000 tests in the last 24-hour period. We're going to keep pushing that number higher and higher so that tests are as available to you as possible, whenever and wherever you need them. Find the site nearest you. If you'd like to get a test, go to online dph.illinois.gov/testing. As of this morning, Region 6, East Central Illinois, has now sustained an average positivity rate of 8% or higher for 3 days in a row. Today hitting a 7-day rolling average of 8.6%, meaning that starting Monday, they will join the majority of the state in operating under resurgence mitigations. That's up from 5.2% in mid-September, the summer peak of 6.2% over Labor Day weekend, and the all-time low of 1.1% in late June. And the region's COVID-related hospital admissions today have tripled since mid-September, up to an average of 18 per day from just 6 per day. As I mentioned yesterday, we're deploying mobile testing to Region 6 throughout the weekend in Richland County today, Effingham on Sunday, in Macon at Decatur Civic Center today through Sunday, and next week, Region 6 will have a testing site from Monday the 2nd through Sunday the 8th at Danville Area Community College. Again, go to our testing site on the DPH website to find a testing site near you. Region 6 is our 10th of 11 regions to require additional resurgence mitigation in recent weeks. The final region, Region 2, which includes Peoria and Rock Island, today crossed the 8% positivity threshold for the first time, reaching a new 7-day rolling average of 8.5% as of today. Barring an unlikely reversal of that trend, 2 more days at or above that 8% intervention threshold will bring Region 2 into mitigations in the coming days. Once again, this is a problem that is affecting the entire state. I'd just like to remind parents and kids alike to make good decisions tonight and tomorrow for your continued good health. Find new ways to celebrate the holiday while staying safe from the virus. And make sure you find a way to build that surgical or medical mask into your costume. The safest way to do Halloween this year, of course, is virtually and from home. That said, for those who want to find more of a middle ground, IDPH has put forward and provided some ideas for how you can have a safer neighborhood trick-or-treat event. That's available on our website in both English and Spanish at dph.illinois.gov/COVID-19. In the end, whatever fun you choose, please remember this virus does not make exceptions for holidays or because you want to take a break from it. With community transmission rates on the rise all around the state, it's more important than ever to take caution, mask up, avoid gatherings, and ensure your family gets through this as safe as they can be. Think seriously about whether you need to be going out to celebrate at all. And if you decide to go out, keep as much of your activity outdoors as possible and remain masked. Let's remember that the quickest way that we get our kids back into schools and businesses open and workers employed is to bring down infections and positivity rates and hospitalizations in our communities. And that means mask up, wash up, back up, and sleeve up to get your flu shot. Before I hand over the podium, let me take just a moment to say that I know you hear those words, mask up, keep your distance. You probably hear those from me virtually every day. You see them around your neighborhood, and from local officials you hear them. In many ways, for many people, I fear they've become like background noise. So let me just remind you of what they really mean. Almost 2 months ago here in Chicago and again in Springfield, I joined faith leaders of every background in a memorial service to honor the 8,000 Illinoisans we had lost at that time to this virus, along with a handful of families who courageously shared their stories of their lost loved ones, allowing us all to grieve with them for those that we've lost. It is a great indignity of this disease that it has also stolen our traditional and more profound ways to mourn. Full-hearted gatherings of loved ones, coming together for the funeral and memorial services that often do perhaps as much for the souls of the living as they do for the dead. At those services in September, we heard directly from some of these families. We bore witness to their pain, a pain that now gets twisted and tormented by the people who go around and declare that efforts to prevent further loss are an assault on their freedom. Whether or not you've lost someone to this virus, it's okay to grieve. It's okay to feel despair. It's okay to feel that the world is crashing down upon you. Even if you look left and right and wonder, is it fair for me to be feeling this way? Yes, it is fair to mourn the losses, the wrenching loss of life, but also the loss of our ways of life. Everything we are experiencing as a state, as a nation, as a world, it is so hard for so many people. And it's harder still when some people act as if the loss of those we love, now nearly 10,000 Illinoisans, more than 230,000 Americans, more than 1 million people worldwide, is less of a loss because of their own personal circumstances. So when I ask you to wear a mask, when I ask you to take care of your community, it's not because I think it's fun to ask. It's because I've heard directly from those who have lost someone that they love, those families whose normal is never coming back, vaccine or not. It's because I don't want any more people to experience that horrible, scalding pain of life lost too soon. A pain made all the more unbearable when the world turns its back on ways to help. The stories that these families share about how their lives are less whole because they lost someone to this pandemic, well, that's what makes me cry. So please, do what it takes to show that you care enough to help where you can. It just might save a life. It just might save you. With that, I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Governor, thank you for those powerful words. Good afternoon. It's Friday yet again. The cases continue to increase, the hospitalizations continue to increase, and the deaths continue to increase. People can look at the numbers however they want to, make their own calculations, insert their hypotheses, but we're not going to deny that hospital beds are being used at a higher rate. Please ask any hospital executive across the state. We have more individuals in the ICU, and we have more people on ventilators compared to just a week ago, 2 weeks ago. Overnight, 3,092 individuals were in hospitals across Illinois with COVID-related illness, and of those, 673 were in the ICU, and 288 patients were on ventilators. Today, we are reporting 6,943 new cases of COVID-19. We've also been made aware of 36 additional deaths. To date, a total of 402,401 confirmed cases have been reported in Illinois and 9,711 deaths. As the governor mentioned, in the past 24 hours, more than 95,000 tests were reported for more than 7.6 million tests. As the governor also highlighted, it's great to see this record number of tests, but what the results show are grim. But even though the numbers are grim today, I'd like to remind everyone that the future is not fixed, and what we do today directly impacts tomorrow and the tomorrows after that. We still have the pen and the ink to author new chapters in this already sad, non-fictional narrative. But with our pens and our ink, we can write better chapters going forward. Please wear a mask today. Help prevent yourself and others from getting COVID-19. That will mean less hospitalizations in the future and less deaths. In a pandemic that has dragged on for more than 9 months, and with the numbers all going in the wrong direction again, it's easy to feel discouraged. We all feel discouraged, but you shouldn't feel like there's nothing you can do. There is something you can do. Public health officials might be running out of options, but you have the most powerful options within your toolbox. And it's the things that we have been saying from here, but we all have to do them. So please, let's take hold of our collective power. Let's take action today. Let's wear our mask. Let's watch our distance. Let's wash our hands. And my new W, let's wage war against flu by getting our flu shot. I know it's Halloween weekend, and I'm urging you to make pandemic-guided decisions, as the governor recommended. Indoor Halloween parties are just not likely to be safe. So let's do the right thing so that our next holidays will not give us a reason to mourn. I'll summarize comments in Spanish. Buenas tardes a todos. La verdad es muy simple. Los casos están aumentando, igual con las hospitalizaciones y también las muertes. La gente quiere ver los números de manera diferente y hacer sus propios cálculos, pero no se puede negar que se está utilizando más camas de hospital, más personas en la unidad de cuidados intensivos y más personas en ventiladores en comparación del mes pasado. 3,092 personas en Illinois estaban en el hospital con COVID-19. De ellos, 673 pacientes estaban en la unidad de cuidados intensivos y 288 pacientes estaban en ventiladores. Hoy informamos 6,943 nuevos casos de COVID-19, incluidas 36 vidas perdidas. Hasta la fecha se han reportado un total de 402,401 casos confirmados en Illinois y un total de 9,711 muertes. En las últimas 24 horas se informaron 95,000 pruebas para un total de 7,6 millones pruebas. Aparte del número de pruebas que se hacen cada día, los números van en la dirección equivocada. Pero me gustaría recordar a todos que nuestro futuro no está fijado. Lo que hacemos hoy impacta mañana y los días siguientes. Usar una máscara. Si usar una máscara hoy nos ayuda a proteger contra COVID-19, lo que significa es que mañana no estaremos en el hospital con COVID-19. En una pandemia que se ha durado por más de 9 meses y con casos, hospitalizaciones y muertes aumentado nuevamente, es fácil sentirse desanimado. Pero hay cosas que podemos hacer, pero todos tenemos que hacerlos. Especialmente a los que celebran Halloween mañana, tengan mucho cuidado y practican los 3 M's. Muchísimas gracias para su apoyo. And with that, I'll turn it back over to the governor.
We'll start with questions from the room and then go on to the computer.
Eric?
Governor, I know you've been asked this a couple of times in the last week, but you said that you're not considering another iteration of the stay-at-home order. At what point, if all 11 regions are in mitigation, I mean, what would trip this move into something a little bit more broad?
Well, as you know, in our resurgence mitigation plan, we have 3 tiers of mitigations, and most of the regions, 10 out of the 11, are in Tier 1. Region 1 is in Tier 2 because after several weeks, their positivity rate continued to go up. But when we impose these mitigations, our hope is, as happened with Region 4 and Region 7 when they tripped into the resurgence mitigations and then were able to come out of it, the resurgence mitigations are intended to start to bring that positivity rate down and bring, hopefully, hospitalizations down and so on. So we have the option of going to Tier 2 and Tier 3 for each of the regions.
The stay-at-home is not something you're even looking at right now?
It's not something I'm considering now, no.
Just one question for the doctor, a medical question. Do you have a current R-naught and what how that compares to the low water mark over the summer and compared to what it was also in the spring when it was at the high water mark?
Well, definitely, it's not at 1 or below. We have to get our most recent calculations. I know that is produced by my team. I think the last one that I saw was 1.6, but I can get the most recent number at our next meeting.
I wanted to ask you about restaurants. I'm sure you know 37 restaurants in McHenry County are vying to stay open, 5 in Park Ridge, 1 in Barrington. And the IRA, Illinois Restaurant Association, came out today saying that they're moving forward with legal action after these new mitigations because they say this will be disastrous for the industry and their workers, and they're going to file an amicus brief. What is your reaction, and do you feel like you're losing control of the people of Illinois?
Well, we're talking about restaurants and bar owners, and so let's just say very importantly that there's no doubt that people who run businesses in this state, and particularly the restaurant owners and bar owners, are suffering, as they are all across the nation, I might add. If you look at many other states, there's been significant drop in capacity allowance in those states, or closure altogether. And there's no doubt that there are many that are suffering. And as you know, the state has provided big grants, the business interruption grants, for, well, now around 2,000 of those bars and restaurants, and will continue to work to provide them some mitigating financial support. But you know, the fact that bars and restaurants are more dangerous places for spread, they're really amplification points for people who are sick, who go into a bar or restaurant. It's very easily spread in that environment, as many, many studies have shown. Just to remind you, we're talking about a CDC study, we're talking about studies that have been published in the Journal of the American Medical Association, in The Lancet, many international journals. It's clear that there's no real difference between going into a bar or restaurant in one state than in another state. So when you see the evidence in states all across the nation that people are transmitting the disease in bars and restaurants, it's true here in Illinois too. It's unfortunate. Look, this disease is unrelenting. It doesn't care about what the location is, and what we're trying to do here is to limit the cases, the hospitalizations, and the deaths. One more thing, which is, we every day we now see these numbers going through the roof. And so the idea that we're going to, make the locations that are amplifying the number of cases and the spread, the transmission of this virus, that we're going to open those even more at this point makes no sense to me.
Because they just wanted to sit down because they think that they've been going over all the safety measures, social distancing, sterilizing everything, wiping down every chair, every countertop, and they want to meet with you. Are you willing to meet with them?
Oh, yeah. And let me say one other thing, which is I think bars and restaurants have done a good job of, in all the areas in which we have allowed them to remain open too, outdoor tents and outdoor igloos, to keep people warm as the weather gets colder, in pickup and delivery. And I want to encourage everybody that's listening and watching, please support your local bars and restaurants. Please make the effort to reach out to them, to use their services. We do want them to do as well as we can possibly have them do during this time. And again, the state will continue to support them.
Governor,
yes, sir.
On that IRA topic, they do say that they are the most regulated, some of the most regulated industries, and they've adopted to many of the policies here. But the question many are asking, if you close down indoor dining in these regulated restaurant places, the fear is groups will instead gather privately and drive up COVID rates in unregulated private places like households. Can you respond to that?
Sure. Let me be clear that there are multiple locations in which the spread of the virus is taking place. One of them is in private homes, while businesses, restaurants, and bars have been open. And the fact that going into a home can be a spreading location is to some degree unrelated to the fact that you can go into a bar. Remember, you go into a bar or restaurant, you may be with some friends of yours, but you're also now with a whole bunch of other people that you don't know. And so the idea that your bubble is somehow protected in a more public place than in your home is just not accurate. And again, I want to say that if you want to see the studies, and I think we've sent them to you, I hope people will read them, and the many articles about the spread of the virus in these locations. It's clear that we need for sure to limit bars and restaurants at this moment. We also need for people to pay special attention to those gatherings at home, to not do it. And this takes a lot of personal responsibility on people's part, because we're not going to be knocking on their doors about it. We just want people to do the right thing, and we're very clear about that, and I'll say it over and over again.
Can I ask you another follow-up on one of your headlines today about testing 95,000 in the last 24 hours?
Yeah.
We have some video coming in of people around the block many times in places right now. It speaks to that quantity.
Sure.
While the state is setting COVID testing records, is there concern about the ability to handle this upsurge? Can you talk a little bit about
with testing, you mean? Yeah. Look, I'm always concerned, I suppose, if 150,000 people show up on a day when, we can only handle 100,000 tests, for example, then that would be a challenge. We're going to try to get everybody a test, though, that's for sure. Now, I will remind you that we have these additional antigen tests, which are they haven't quite come online. You don't see them in the numbers when you look at our IDPH website because there are not very many being applied right now. But there are many available, and they will be applied. We're using them for surveillance, for example. We're using them in specific kinds of locations like long-term care facilities, et cetera, so that we can get more testing going in those locations. So you'll start to see those in the numbers coming up. But yes, I always worry about not having enough testing. It's why I've been on top of testing from day one, and it's why I'm happy that we're where we are. But 95,000, just to be clear, is nearly the top of the nation. That doesn't say anything other than we're working really hard at it and maybe better than many other states. But I worry it. Yeah, every day I worry.
We'll do one more in the room. You told the IRA yesterday that you're going to give them the data, and did you hand them that data? And also, they're worried about the 2 weeks will turn into 2 months, will turn into 4 months.
About,
For
2 weeks.
keeping restaurants closed, for in-person dining.
No, I want to get restaurants and bars open as soon as possible, and I've told you that if you look at the resurgence mitigations, if we can get regions down to 6.5%, we can reopen to where we were before. 3 days, yeah, but it's 3 days. It's really not, it's not that long. It's not a week, it's not a month, it's 3 days. We do need to bring those rates down. We're working very hard. One of the reasons for the resurgence mitigations is, in fact, to bring those numbers down. So, we're going to continue to follow the science, follow the data, and try to move everybody to personal responsibility, wearing a mask and washing their hands, doing the right thing. That really ultimately will make the biggest difference of all.
Tony Arnold at WBEZ. With France and Germany announcing nationwide lockdowns, have you given any more thought to another stay-at-home order for Illinois, and do you think it would be effective at slowing this recent spike in cases?
I'm not currently considering a stay-at-home order for the state of Illinois. Obviously, it's something in the toolboxes of other countries that they're taking, they're moving forward with because of the rate of infection there. But right now, I think, we have pretty good mitigations within Tier 1, Tier 2, and Tier 3. And it takes a couple of weeks for the mitigations to take real effect because, as you know, when somebody gets sick on one day, it may be a week before they end up in a hospital. It may be another week or two before they might end up in an ICU. And then, of course, some of those will end up on a ventilator, and unfortunately, some will die.
Jim Haggerty at the Rockford Advocate. Governor, we're seeing more churches in Region 1 meeting in person with masking and social distancing. Is that something that's supported by your office, or should churches stop meeting in person under Tier 2 mitigations?
I want people to be able to worship, but I also want people to be safe. And so we've told pastors across the state that we would encourage them to have online services. We'd encourage them to have very small gatherings that might be broadcast to others. I think that's the safest thing to do, particularly in this environment. As we say about bars and restaurants, for example, add on top of that kind of environment where people are maybe packed into a building together and not socially distanced, that there are people that are unmasked and singing, and we know that spews droplets out into the air and can be more dangerous. So we're encouraging everybody to just be extraordinarily safe. We prefer stay-at-home, services so that people can watch and listen online.
Dave Dahl at WTAX. Complaints continue that you're freezing out lawmakers. A 3-minute conference call yesterday and a refusal to share your data. What would make lawmakers say this about you? I
think you mean a 30-minute conference call, not a 3-minute conference call. It's pretty hard to have a 3-minute conference call, and that didn't happen. We're not freezing anybody out. I speak with lawmakers all the time. I've spoken with both Republicans and Democrats, multiples of them. Over the last 2 weeks, I probably have spoken with 15 or so members. I can't get to all 177 members of the General Assembly all the time, and I hope that they would call me and call my office if they need something, if they want to discuss these things. I certainly reach out to them when we know that we're heading into these difficult moments and try to get their feedback and their help. And I've done that all along. We've made a lot of adjustments because of recommendations that we've gotten from members of the General Assembly. And of course, we work with them on the commission that was created for our plan for Illinois. And so I'm regularly talking to the folks on that commission.
Okay, so Cole at WCIA, Dan Petrella, and Jim Leach all sort of have the same question. I'm going to try and combine.
Are they working together on this? Or
no, but it's very similar. So a lot of vocal pushback from people in the restaurant industry.
Sure.
A lot of businesses ignoring the mitigations. How long will it be before businesses start seeing their licenses revoked, and what sort of other enforcement are you looking into to make sure that these businesses are following?
Well, the most important thing is for local leaders, local law enforcement to take responsibility here. That's been true all along. And some have, some haven't. There are local governments that have put in place mask mandates that have fines associated with them. There are local governments that have taken this seriously and had law enforcement warn, which is all we've really asked, is go in and warn these locations that you're overcrowded. We need you to reduce the number of people in it. Maybe a dispersal order of some number of those people might come after that, and it's only on a final visit that the possibility of a fine being issued might take place. So, but that's been happening. The warnings have been happening in, I think, 37 counties. You heard the ISP director say that here just 2 days ago, I believe. And, you know, and those citations have been issued in 5 counties. So we're continuing to enforce as best we can, but we do need the cooperation and help from local officials.
Ryan Boyles at Health News Illinois. You recently said Metro South Hospital is being kept warm as a potential option in case there's a need for an alternate care site. What's the latest with the other alternate care facilities identified earlier this year, like Westlake Hospital, Old Advocate Sherman, and Vibra?
Yeah, we're not currently looking at using those facilities. They're not under contract with us. As I understand, those contracts have waned, and, you know, we might come back to those facilities if we would need them. I hope we will not.
Kelly at Block Club will be our last question today. Is the state planning to provide any more tax relief for small business owners hit hard by the pandemic?
We'll certainly look at what more we can do. As you know, we're providing direct subsidy, in fact, dollars directly to those businesses to help them out, and that might serve as some mitigation for them of the financial challenge. But as you know, the finances of every city and every state are, have difficulties, and so too the state of Illinois. So we'll do the best we can, but we are going to need help from the federal government, as I've said all along.
Oh, sorry, I forgot 2 questions.
Okay.
Can Dr. Ezike talk about how well-staffed and equipped hospitals in Region 3 and 6 are to handle the rise? And also, can you elaborate on some of the locations that we're seeing the outbreaks, and how does this wave compare to the outbreaks we saw in nursing homes in the previous wave?
It's quite a few pieces in there. Okay. First question regarding regions 3 and 4, 3 and 6. So regions that when I look at the state and look at what's happening in our hospitals, in my mind, I'm putting 7 regions, 7 through 11, which is essentially northeast Illinois. I'm kind of differentiating that from regions 1 through 6, and I'm doing that because the biggest burden of the first wave was borne by regions 7 through 11. Of course, every single county, every hospital saw COVID, but it was heavily borne by 7 through 11. So they have been through this. They've had to surge. I'm saying that regions 1 through 6 had not had the threatening of using nearly every bed to deal with the effort for that first wave. And in fact, as I'm looking at all the hospital capacity, all the bed usages across the state, I'm seeing that the numbers that we have in the hospitals in regions 1 through 6 are already at their peak levels from wave 1, right? So we are already seeing numbers that these hospitals saw at the highest point of wave 1, and we are not at the peak now. So that's just to frame it and make sure we all understand that we are getting into territory that most of these hospitals had never seen before. So as we see that, there is concern that regions 3 and 6 have the possibility, not today, if someone, I don't wish this on anyone, but if someone were to get sick today, there are beds for everyone today. But if you forecast out with the amount of cases that we're having, which suggests a certain number of hospitalizations in the future, we do predict that there could be shortages in as short as 2 to 4 weeks. And so we have been on the phone, my team, with hospital leadership, with the Illinois Health and Hospitals Association, to discuss what the plans are to ensure that if someone is coming, whether it's for COVID, whether it's for a flu-like illness, whether it's for chest pain and an acute MI, a heart attack, or a car accident victim, that there will be beds for these individuals. And so we are talking through those very important measures to make sure that we can deal with what we are going to see in the pending weeks and months, but also understanding that we can make sure that we have fewer cases by stopping infections today and tomorrow.
And are most of the cases still 20 to 29-year-olds?
And that's driving the total positive cases, but they don't form the majority of people in the hospital.
Can you talk about the capacity, what you just said, for the 1 through 6, 2 to 4 weeks? How is 7 and 11 through 11 looking in that regard?
So the numbers that we're seeing in regions 7 through 11 is not anywhere close to what the peak was for the first wave. So that's what I'm saying. They are not in a position, they're not currently in a position where they're already higher than what they've seen before and not quite sure how they would surge to another level. They are not close to the numbers that they saw at the peak. So there's a big difference between regions 1 through 6 and 7 through 11. Did I
Yeah, I
miss?
think you got that.
Okay, great, thanks.
And then, sorry, this is the last one.
Sure.
It's from Marianne Ahern. Governor, can you please react to Mayor Lightfoot earlier today saying she's worried about businesses, especially bars and restaurants, and doesn't know if they'll be able to come back, and she insists bars and restaurants are not the source of spread in Chicago, but rather it's personal gatherings, and she would also like Dr. Ezike to respond to that as well.
Sure, I think I answered that a little earlier in this press conference, but I'll say, first of all, that as I have, believed all along, the effect on businesses of this virus is tragic. I mean, it is, and it isn't just bars and restaurants, it's retail, it's all kinds of businesses that are affected, and livelihoods. Many, many people who have suffered the loss of a job as a result of this virus. I grieve for them, and I also want to provide them the best support that we can. But let's be clear that there is ample evidence, and I'm going to once again hold up for everybody just the packet of just the beginnings of the studies that exist here about bars and restaurants that we provided to the press and to many local officials who've complained about their bars and restaurants, for example, or the chambers of commerce or restaurant owners, and remind you that people are dying. Period. We just had 6,900 people detected with coronavirus. That's more than we've seen ever in this state, 6,900. We now have hospitalizations going up. They're almost double what they were just a few weeks ago. And this is extraordinarily dangerous. This is an extraordinarily dangerous time. And as a result, we must do everything in our power to keep down the infection rate. And that means reminding everybody not to have parties in your home, to make sure that you're keeping your bubble small, your nuclear family if you can, making sure that if you are going to see people in a private setting, that everybody wears a mask that isn't in your private bubble, or that you keep 6 feet apart. And I just, all I can say is that I am going to fight this virus. We have got to get these numbers down. And you know why? So we can reopen the bars and restaurants. So we can reopen our school, make sure that our kids can go to school. The schools are open to the extent they choose, to have in-person schooling. And I want every kid to be able to go to school in person every day. And so we have got to bring down these numbers so that we can restore the businesses, restore education. We can get there. I know we can.
Okay, thanks,
Yeah.
everyone.
Thank you.